Hello, everyone. Welcome to the Child Early and Forced Marriage webinar series with the Gender and COVID-19 Working Group. We're delighted to present today colleagues from Uganda who are from Joy for Children Uganda and the Girls Not Brides Coalition in Uganda. And there are several presenters, and so we're really happy to welcome all of you here. Because there are several presenters, if you would like to present yourselves and introduce yourselves further, we'll be eager to hear about you, and then we can follow the presentations with a moderated discussion. So welcome, and the floor is yours.
Great. Thank you, Bahi. So I'm Sushmita and I co-facilitate this gender and COVID subgroup of child and early and forced marriage with Bahi. And of course, it's an immense pleasure to welcome you all here. As Bahi mentioned, we can go one by one introducing ourselves, or maybe I can go with the series that's coming in front of me. May I request Gilbert to go first and introduce?
Good afternoon to you.
Good afternoon.
Called Ifagara Gilbert. I work with Kana Foundation for Outreach Programs. It is in Fort Portal. Thank you for coming.
Thank you. Namara?
Good afternoon, everyone. My name is Namara Barbara. I work with Joy for Children based in Kampala. Nice to meet you.
Thank you. Moses. Moses, can you hear us? Okay, Rachel.
Hi, I'm Rachel Kidman. I'm a professor at Stony University in New York.
Thank you. Then Rev. Rev, we can't hear you. Savita.
Hi, this is Savita from India. I work as an international volunteer with Voluntary Service Overseas, Mozambique. Thank you.
Thank you. Moses, we couldn't hear you earlier. Moses is still connecting. And Rev from Defora, we are unable to hear. I see your mic is on, but we can't hear you. Moses, do you want to introduce yourself, please, now? Eliane, yeah, Moses, please go ahead.
Can you hear me?
Yes.
Yes, I'm called Moses Intenga, and I'm the director at Joy for Children, but also I chair the Girls Not Brides Uganda, the National Partnership to End Child Marriage. Yeah, I'm happy to be part of this conversation. Thank you.
Right. Eliane, quick introduce.
Hello, hi everyone. I'm Eliane and I am currently based in DMV area. I serve as the policy and advocacy coordinator for a program from the Department of Housing and Urban Development. So very excited about this conversation.
Thank you. So over to you, Bahi.
Great, thank you so much, everyone, for those introductions. It's wonderful to be here together. So I turn the floor over to our presenters, Barbara and colleagues. Welcome again. Thank you.
Do we know who would go first?
Okay, I can go first. It's okay.
Yes, absolutely. Let's start.
Okay. Someone allow me share my screen.
It should be available now.
Okay. Hello, everyone. Once again, I'm Barbara Namara from Joy for Children. And the basis or the title of our presentations is based on empowering existing structures to end child marriage in Uganda amidst COVID-19. Joy for Children is an NGO or a non-governmental organization that was founded in 2005, and it aims at advocating all rights for children to live peacefully without exploitation, to access or to be able to access free quality education with economic empowerment, access to clean water and good health plus nutrition. Since 2012, Joy for Children has been hosting Girls Not Brides as an alliance in child marriage, or as the Ugandan Partnership in Child Marriage, with a membership of 103 organizations. Child marriage in Uganda, 40% of girls in Uganda are made pregnant or they are married off before their 18th birthday, and 1 in 10 girls is married off before the age of 15. The situation worsened during the COVID-19 pandemic or the lockdown, whereby the Northern Uganda region registered 4,511 both teenage pregnancy and child marriage cases. And also the Western region, where we happen to have our projects being implemented, that is Kiliandongo, Chegegwa, Kamwenje, Isingiro. It recorded 4,689 teenage pregnancies and both teenage pregnancies and child marriage cases, as per the newspapers reported. It was last year, Joy for Children received a 1-year funding from the People's Code Rotary Grant, and this was aimed at, or it supported the implementation of accelerating progress in child marriage in Uganda. The grant was sub-granted to the 5 numbers of Girls Not Brides members who are from the refugee hosting districts reason, because we thought, or it is, most people from the refugees districts or the refugees communities, they are vulnerable to so many dangers. For example, teenage pregnancy, child marriage, violence against children, since they're from different communities. And these include Arua, Kiliandongo, Kamwenje, Chegwego, and Isingiro. The accelerating progress in child marriage aimed at unlocking the potential of a wide range of partners, encouraging them to increase efforts, collaboration to demonstrate that accelerated change at a scale is possible, focusing on different areas. And we focused on a number of 3 areas, whereby the renewal and implementation of the National Strategy to End Child Marriage and Teenage Pregnancy, which expired in 2020. And the sexuality education framework to be adopted, implementation plan developed, and budget allocation in humanitarian and non-humanitarian settings. And then stories of change to be amplified or profiled. The specific interventions or activities that Joy for Children and Girls Not Brides have empowered the existing structures to end child marriage in Uganda amidst COVID-19 are as follows. Joy for Children and Girls Not Brides supported the 5 members of Girls Not Brides through the sub-granting of the grant that was got from PPL, and these were districts of Arua, Kiliandongo, Kamwenje, Isingiro, and Chegwegwa. This helped in the formation of the 100 champions who were recruited and trained. And these champions included traditional leaders or cultural leaders, and also religious leaders, plus the local leaders at the district level and also the village levels. These 100 champions helped in strengthening the structures at the local base or the local community. And they also helped the IPs or the implementing partners to implement the project through reporting cases or organizing members for different trainings and other activities to be engaged at the community level. Joy for Truth conducted, or GFCU conducted, 2 regional outreach events that focused at attracting many local organizations into the alliance. This was through the communication and the budget allocation activities, whereby members of the alliance were invited and trained how to communicate different cases and how to allocate the budgets at the district level. So many people or other organizations saw the good thing of these activities, and that's why we had a number of enrollment increase from 89 to 103 this year. Joy for Children also identified and worked with strong media houses, for example, Daily Monitor and NBS and other media reporters. This has helped in changing the perspective or the narrative of how media people report cases and how they are being written about in the newspapers or in the press. Also, Joy for Children supported the national level structures like the parliamentarians or the parliament by engaging them in the advocacy work, which led into the drafting and tabling of the motion. And this motion aimed at requesting the government to quickly respond to the escalating cases of child marriages that were increasing during the COVID-19. Joy for Children and Girls Not Brides created a platform and engaged the 2 youth as activists who were trained and funded to go to communities and encourage other youth to stand up and speak out to the issues that were affecting them. This helped the people who were the youth, especially the youth who were very quiet about the issues that were affecting them, to come up and share their experiences with the media houses or with the IPs, so that we can see the many issues that affects them and how to go about it. Also, Joy for Children and Girls Not Brides established 5 budget advocacy committees. The purpose of these 5 advocacy committees were to implement or to also monitor the budgets at district level, how towards the child protection unit, in case how much budget is allocated to child protection, how has it been spent, how much is lacking, and what can we do to improve the budget so that these children or these young girls have been helped in one way or the other. Last but not least, Joy for Children has engaged many multi-sectors through organizing different organizations. For example, a 3rd national summit that we had, which was comprised of different national organizations, different ministries like Ministry of Gender, Ministry of Education, and Ministry of Health. This was to enhance the collective action towards ending child marriage in the face of COVID-19. And we're also planning this year to have the 4th National Girls Summit during the 6 days of activism to see how we can go about the issue of child marriage. And we believe it is very possible to end child marriage in our communities. Lastly, my last slide, there are recommendations. Recommendation number 1 is designing effective strategies for reaching out to stakeholders, communities, and adolescent girls about the dangers of child marriage and also teenage pregnancy through use of drama, music, and acts, or all skits or short stories. This will help to deliver the message directly to the people that are abusing children, and also encourage more on what has been seen on televisions and make people acting it physically. Also, facilitation or supporting the local governments, for example, the police in the Child and Family Protection Unit to implement. These people need to be facilitated. For example, the police will have all the information, for example, through their phone call. This child of 18 years has been abused, has been this and this, but they will not have the transport or the money to go and reach out to that very person and know what exactly is wrong. So most of these cases, they are mostly neglected. Support the formation of community-based information systems to capture the information and data. Support districts that already have in place developed plans in child marriage and teenage pregnancies, and also encourage the district that do not have anything, or they have not developed any plans in child marriage. We should support them and put something in place. Thank you. I would like to display my video that's up.
Kabali ishomero n'ishami nageze baganira uno musigazi katwaheze kuganira byakurasireho tazo bintu byo mbona mena atinjire
Stephen Kadiwara, the Executive Director of the Development Foundation for Rural Areas, in Kigegwa, child marriage and other cases related to child abuse and neglect have.
I'm sorry, I'm not seeing the video. Anybody else?
Yes.
Yeah,
I'm
we
also
aren't
not able to see
the video.
I beg your pardon.
Would you like to maybe stop screen sharing and then put the video on and start screen sharing again? Because we just see the PowerPoint, not the video.
Okay, sorry.
No problem. Thank you, Rachel.
Okay.
Yeah, this seems pretty common. It's hard to get videos to go over Zoom correctly.
Is this okay now?
Yeah.
Yes.
Yes.
kabali ishomero nageze baganira uno musigazi twaheze kuganira byakurasireho tazo bintu byo mbona mena atinjire
In Kigegwa, child marriage and other cases related to child abuse and neglect have increased dramatically.
Cases of early marriages are very rampant in Kamundo district. And when we talk about early marriage, we rate it with defilement. You find any child below the age of 18 years is married, whether forced marriage or voluntary. There are even some individuals who are We enroll then they reach P4, they start dropping out. They early marriages, which is very bad, and the early pregnancies have had to one one of the different cultures.
iko natusumbua sana koza kidogo na watu wako wengi, mmoja anapata wengine wanakosa, pia kula mashitula wanakimbia tushapiga malalamiko wakubaliwa wanazana wangali wadogo bako.
When we look at the number of parents whom we are having in schools, most of them got married before the age of 18.
We are facing a challenge in that the parents connive with some stakeholders. You find those marriages continue, then you discover the family has been there, and even the woman is now 18 years, and it's difficult to take them to courts of law.
Those challenges, of course, there is culture and poverty. Poverty and illiteracy. Challenges here.
Patana na maisha yenyewe wako nayo kwabo, inabidi waende njia mbaya. Ukienda njia ile mbaya kutana na maisha ile wako nayo, ile inakuwa mbaya.
The challenges we face. First of all, somebody gives the information. They don't want to come openly and come and report the statement. They want information to be treated confidential. It's like the secret identities of the reporters. Children are out of school.
Accelerating to end child marriage, accelerating progress we have to be assertive in as far as fighting that early child marriage is concerned.
Since we are trained by the fora, I have been meeting with parents. Maybe on the way you talk to them, you ask how the children are at home, what they are doing, and how they are caring for them, and how they help them.
I'm very much excited to be here this morning. We are the colleagues of district leadership, trying to be
One of the reasons we are here is advocating for girls' rights, but also issues of access to gender equality and any child marriage.
Here we are in team to see our young people not get married when they are still small.
Recommendation. These people from the offices will not come. But from around, we will go.
desensitizing person comes from the same community. They speak the same language, they will understand each other, and again, they will be society.
Is key. I think that's where I'm getting out of this most. Just putting a message out, saying marriage is a beautiful thing, but at the right time.
Thank you for listening to me.
Thank you, Namara. Namara, can you right to Namara, can you transfer the host to Bahi?
I beg your pardon?
Namara, can you click on Bahi's name on the participant and make her host back?
I beg your pardon, I cannot hear you clearly.
I'm requesting you if you can click on Bahi's name on the participant and make her host back, because then we will be able to facilitate the next presentation.
Okay. I think Gilbert can present from Kana Foundation Outreach Program.
Yeah, so Namara, you need to make
I'm ready.
host again. You need to transfer. Make Bahi.
Hello? Barbara.
Yes.
Hello, Barbara. You can let me and show my presentation.
It's okay. You can
On
talk
your
to
screen.
Okay. A minute, please.
Yes, once again, I'm called Kamara Gilbert Isagara. I work with Kana Foundation for Outreach Programs found in Fort Portal. As our title is saying, empowering the existing structures in ending child marriage amidst COVID-19. Barbara, next slide. Introduction, Kana is a non-government organization, non-partisan and non-profit organization working in different districts of Kabarole, Unyangabu, Kienjojo, Kamwenge, Abundubujo, Kitagwenda, Ntoroko, and Kigegwa. Kafopi vision having a community where all people live a free, safe, and dignified lives. Kana Foundation for Outreach Program aimed at sustainability, visibility, and ensuring child safeguarding and protection. Next slide, please. child marriage in Uganda. Since COVID-19 hit Uganda, the president with Minister of Health imposed restrictions such as closure of schools, workplaces, and public/private means of transport, which led to increased cases of child neglect and abuse. Child marriage is among the most reported cases of child abuse. Statistically, between March 2020 and June 2020, teenage pregnancies increased to 22.5% among the age of 10 to 20 young girls. Among girls aged 10 to 14, cases of child marriage and teenage pregnancies increased by 36.5% from 290 in March to 353 in September 2020. And here we are having age between 15 to 19. With funding from the People Postcode Lottery grant through Girls Not Brides Uganda and GFCU, CAFOPI implemented a 12-month project entitled Accelerating Progress Towards Ending Child Marriage in Uganda. The project implemented in 4 sub-counties of Bwizi sub-county, Kataliawa Town Council, Nkoma sub-county, Hanga sub-county, surrounding Ramanja Refugee Settlement Camp in Kamwenge district through the use of ecosystem approach. Various outcome areas were achieved, and the outcome one is increased government commitment towards the renewal and implementation of the national strategy to end child marriage and teenage pregnancy and sexuality education framework at both national and subnational level. Come to key champions, including traditional and religious leaders in Uganda, are publicly supporting alternatives to end child marriage, challenging traditional gender norms, and playing a key role in shaping public opinions. Next slide. As specific intervention activities, as CAFOPI, we had organized some of the activities. We had sub-national level policy meetings in Kamwenge district. The purpose of the meeting were to review the progress of the project to the 4 sub-counties. And this was done at the district level to ensure that these people come up and we see how the progress is, how is the progress within Kamwenge towards the base of ending child marriage. Involvement of radio stations such as Nyumbani FM, it's a local radio station. Hits FM has increased on awareness on ending child marriage and also increased reporting that has enabled tracking cases of child marriage. CAFOPI engaged in policy meetings to learn on the best practices of reducing preventing child marriage in Kamwenge district. CAFOPI participated in a budget advocacy committee, which helped to influence the budget, follow up on the intended activities to be implemented that aims at ending child marriage in the Kamwenge district. Next slide.
Yes, Gilbert, you can go on.
CAFOPI also empowered to advocate for the change towards the reallocation of funds to affect the government budget, considering a positive response in line with ending child marriage. This is through tracking and monitoring the district budget activities that aims at ending child marriage. Kana Foundation, with support from Girls Not Bride Uganda and Joy for Children Uganda, managed to identify youth champions, train involved in peer-to-peer learning activities within Kamwenge district. Champions including traditional and religious leaders holding the most percentage, that is 75% in Kamwenge district, Ramanja refugee settlement area, publicly supporting alternatives to end child marriage, challenging traditional gender norms, and playing a key role in shaping public opinion, helped by other influential people holding 25%. And these other influential people are like the parasocial workers, the community health workers, the teachers, and so on. CAFOPI, through its implementation, the use of champions in challenging public opinions on normalized traditional norms and beliefs has made vast impact. Mostly the religious leaders conduct sensitization, moving in households, worshiping places, and community dialogues to to strongly emphasize the long-term consequences of child marriage. Next. Lessons learned. Youth champions. The youth champions are very key in ending child marriage since they learn from each other. This enables openness and seeking for advice from other champions, i.e. religious and traditional leaders, with other champions like parasocial workers, counselors, community health workers, and so forth. Budget advocacy team. This informs the policymakers areas of improvement according to activities of district budget that aims at ending child marriage. Case monitoring tool. This helps in the documentation of cases related to child marriage and tracking the responsible person to intervene in these cases for a good response and solution. Champions. The involvement of different champions such as religious leaders, traditional leaders, counselors, parasocial workers, teachers has enabled strong house-to-house sensitization and handling cases of child marriage through counseling and guidance. Challenges, project design. The geographical area of coverage due to high population in different sub-counties within Kamwenge district in Ramanja refugee settlement area. We have different sub-counties, Wizi, sub-county Nkoman, sub-county Katariebwa and Bahanga. There was need to increase the budget that could sustain and enable proper documentation of cases, of child marriage cases, follow-ups and completion of judicial court processes. The project system concentrated mostly on advocacy on ending child marriage, yet there are other factors that needed on-site visit, medical examination for survivors of child marriage, supporting the people in authority to follow up cases in different communities in terms of facilitation and other expenses. Short lifespan of the project. Since most of the people, both indirect and direct beneficiaries, had started to analyze, understand, and appreciate the existence of the project, there will be some gaps in implementation through, though Kana Foundation will often make some follow-ups on the existing structures for purposes of continuity. Our recommendations, there is need to redesign the project according to existing geographical structures. This is through projection of the program and also increasing on the budget to enable proper implementation in the Kamwenge district Ramanja refugee settlement area. This will need to increase on the number of champions, budget advocacy committee, monthly radio talk shows, and DJ mentions. The project should also consider cases of poverty. This will enable empowerment of younger girls in income generating activities that will lead to increased enrollment, retention, and completion of young girls, mostly in their primary level. Therefore, there is a need to train the young girls skilling activities such as handcrafts, carpentry, and mechanics. Yes. Okay, thank you very much. I think that's all. Thank you very much.
May I request the third presentation, please? Or if the yeah, Bayu, then over to you.
Please.
Excellent. Thank you all very much. Very, very interesting presentations. So are there any further presentations, or will we open the floor up to a discussion?
There is one more presentation from Defora. Maybe if Reverend Katibara is ready, can start presenting.
Wonderful.
Nwampura. Yes, we are ready for the presentation. Can we share our screen? Hello, are you hearing me?
Yes, we're hearing you. So, Mr. Stephen, if you would, if Barbara would kindly make, oh, okay, sure. Here I can.
Yes, we are ready for the presentation.
Wonderful. You can share the screen now.
Can you see the screen? Hello. Can you see the screen?
We can, but not a presentation. We're just seeing the Zoom meeting.
If you like, you can stop the screen sharing and open the screen that you would like to share, and then start screen sharing. Sometimes that.
Can you hear me now?
Yes, we can hear.
Yes, we can hear you, but I can't see the screen.
Let's try to see how we can.
Is it okay if I can share from this side and you present?
It's the screen?
Yes, your presentation.
Yeah, it's okay.
Okay.
Hmm?
Are you able to see the screen?
Yes.
Are you opening again?
We see just the folder with the 3 presentations in it. Not the actual presentation.
Can you see the presentation?
Yes, I can see. Good evening. I'm Reverend Stephen Kadiewala, the Executive Director, the Forest Development Foundation for Rural Areas, and I'm presenting Empowering Existing Structures on Ending Child Marriage in Uganda amidst the COVID-19 pandemic. So move to the second. Yeah, the FORA initiative, yes. About the FORA is just an government organization, NGO, which was founded in 1992 as a community-based organization, and later it registered as an NGO in 1994 to address the plight of the marginalized, the poor, and vulnerable rural communities, and mostly these were women and children. About the FORA, as I've already explained, it is also a member of Girls Not Brides Uganda. FORA also has been and is still one of the lead NGOs or CSOs in the Rwenzori region with experiences and willingness to deliver on social and human rights, more especially women economic empowerment. And envisaged by its vision as a healthy, informed, and self-sustaining community which is free from human rights violations. Next slide. The working environment since 2019. So the COVID-19 pandemic is creating a profound shock global worldwide with different implications mostly for children, men and women. So the COVID-19 pandemic is quickly exacerbating key factors that put the children at risk of getting married at the tender age. So it is also making child marriage prevention programming such as which is more difficult to implement, also hindering progress on the ambitious goal of eliminating child marriage by 2030, which we find in Sustainable Development Goal 5.3. So right now there are 650 million child brides living in every region of the world. Child marriage is a fundamental violation of human rights, which severely impacts the global economy, peace, security, as well as also hampering the achievement of sustainable development goals. So in Uganda, 34% of the girls are married before the age 18, and 7.3 are married before the age 15. So an assessment conducted by Joy for Children Uganda and Girls Not Raised Uganda under the Accelerator project revealed that over 2,300 schoolgirls conceived during the COVID time, while 128 girls were married off during the lockdown. So the 2020 annual crime report also indicates that a total of 14,134 cases of defilements were reported to police. Next slide. Now, the first initiative on empowering structures to end child marriages amidst the COVID-19 pandemic. So, with support from partners like Girls Not Raised Uganda has and continue to implement a number of projects with key components on strengthening structures in order to end child marriage. So through the accelerating progress to end child marriage, the refugee host sub-counties, the project where we had 4 sub-counties, which was implemented amidst COVID-19. The fora worked with the local leaders to organize 4 sub-county, sub-national level policy meetings related to the implementation of the strategy to end child marriage. So also worked with cultural and religious institutions to identify and also identified and trained 20 champions who have since been making public statements on child marriage issues in communities, and also documented and reported cases to police and organized dialogues. So the FORA established a 10-member district budget advocacy committee to support in budget advocacy at different levels, monitoring and tracking, and we also conducted WASH assessment activities to inform their advocacy work. These are the champions we trained. So we engaged youth who were trained as youth activists at the local level and conducted trainings among our peers to champion the work to end child marriages in various communities in the Gegwa district. So therefore also continue to work with credible local and national media channels, the radios, and also the reporters who continue to influence narratives of ending child marriage in the area and in Uganda at large, as we also use the TV stations. The FORA's initiative continued, empowering adolescent girls in primary schools so as to access affordable, reusable sanitary pads amidst COVID-19. In 2 districts here, we had to extend our services, even to Kenjojo district. So as a result of the accelerator project, FORA partnered with a local organization, in fact, it's a national organization that is Days for Girls, and trained adolescent girls on reusable sanitary pad making. So a total of 600 girls from 10 schools, were registered and trained in reusable sanitary pad making and positive discipline. So young girls were trained on prevention of violence and reporting perpetrators of violence to local justice structures in the districts of Kenjojo and Kiegegwa. Next. The initiatives continued amidst the COVID-19 pandemic. The FORA continues to implement interventions on building local structures to end child marriage. So our current project on strengthening resilience and economic empowerment of adolescents, girls and women in refugee and host communities of Kiegegwa district amidst COVID-19 pandemic. And this project will aim, which is upcoming, will aim at achieving the following: promoting household economic recovery to reduce vulnerability of children and adolescents to violence amongst refugees, hosting communities, and amidst COVID-19 pandemic. It's also to create a local structure as a platform to empower 120 adolescents, that is 80 girls and 40 boys, in entrepreneurship skills. Also empowering a network of community peer facilitators, equipped life skills and which are better able to contribute to the individual and also community development. Next slide. Now recommendations: designing effective strategies for reaching out to stakeholders, communities, and adolescent girls about the dangers of child marriage, like use of drum and music, facilitation, support to local governments, the police, child and family protection units to implement. Also support the formation of community-based information systems to capture information and data. Also support districts that have in place developed plans to end child marriage and teenage pregnancy in the district. Next. Thank you so much for listening. This has been Reverend Stephen Kalieva, Executive Director, Development Foundation for Rural Areas, based in Kenjojo, but implementing its activities in both Kenjojo and Kiegegwa district. Thank you so much for listening.
Thank you so much, Reverend. To you, Mary.
Sure. Thank you all so much for those very, very informative presentations. Each one, added so much. So if we would like to maybe spend a few minutes for a broader discussion, if anyone has questions, please jump in or feel free to raise your electronic hand.
Hi. I have one question and anybody can answer. My question is that on what aspect do you advocate with government? What is that critical piece that you are really knocking the doors of the government to really make some policies or take up the project or something like that?
Come again, please.
My question is that what is your advocacy agenda with the government? What is your top priority or the demand from government?
I'm not getting the first. What is the demand we want from the government, or how do we advocate for our government to help us in ending child marriage?
Yes.
Okay. Okay, Mr. Ntenga Moses is coming in to help him.
Hello. Hello. Can you hear me?
Yes.
Yeah, I think as a part of our work also with our partners, we have strategically worked on some of the activities or components that allow us to engage the government to improve some of the policies of laws and also programming around issues of child marriage. For example, we have been working with the Uganda Human Rights Commission to be able to document cases of child marriage around the country and be able to present the same report to Parliament for deliberations, but also action on preventing, on supporting, addressing issues of child marriage. Secondly, we are working with a cluster of members of Parliament. We're working with a section of members of Parliament, especially those that have inclination on human rights, child rights, as well as the women within the Parliament, to be able to push for some reforms that have a bearing on women and girls. So, for example, recently we worked with members of Parliament to table. We worked with members of Parliament to table a motion on ending child marriage and teenage pregnancy during and after COVID-19. The motion was tabled and debated around 8th of April this year, and a lot of recommendations were made, and most significant made by the Speaker of Parliament was to do a national audit on the impact of COVID on children, on child marriage, as well as teenage pregnancy. But also we directly work with the Ministry of Gender on issues to do with the child marriage, both providing our technical expertise and also linking them to civil society organizations as well as the beneficiaries to be able to move the agenda of ending child marriage. One of the things we have also were able to achieve at the end of the national strategy on the national strategy to end child marriage, we compelled the government to do a study on its effectiveness, call it a midterm review. Because of our concerted efforts and pressure, they were able to do the review, though it came in late and was turned to be an end-line evaluation. We were able to know how the strategy was doing and what more needs to be done. And currently we are working with we're engaging the government to be able to renew a new framework that will guide the country processes and plans on ending child marriage. So those are some of the components, but also importantly, also we are using data, collecting data to be able to inform the government as we do our advocacy. So there are a number of things we have done, but those are some of the key strategic intervention we have done to engage government to do work around ending child marriage and also keeping child marriage on top of the government agenda.
Oh, great, thank you. Do we have anybody else with the questions? Rachel? Okay. Bahi, do you have any questions?
I think also probably our colleagues, our colleagues also who joined, I think, who are implementing at the grassroots in the lower local government, probably they have some thoughts. And one of the things they did also at the lower district was also to create, to form the budget advocates or champions who worked directly with the local governments to push for reforms that end child marriage, to include some components in their district budgets that have a bearing on issues of girls, especially maybe in issues of sexual reproductive health in schools and other, maybe sanitation, among other issues. Maybe if there is any who can chip in, I think that would be great.
Sure. Any other inputs?
Maybe add on, this is Gilbert. Hello?
Yeah, we can hear.
This is Gilbert. Right. As IPs, we have really gone on the grassroots and worked with the district coalitions and the local government structures to ensure that cases of child marriage are well handled. And most of the cases have been reported both at the health facilities and the police station. But these cases of child marriage which have been reported at health facilities, they have been very hard to get, because since the police does its work on the ground to get these cases, and the health facilities, they assume it is very confidential to release those cases to the police. It has also been giving us a challenge, and we are trying to see if a child has come, a teenage girl has come to get some services at the health facilities, and is below 18 years, what can the police do to get those cases and see that they work amicably, to see that these people, they are not really being annoyed, because when they are taking those cases and the police comes in and say that this is a case of child marriage, or this is a case of defilement, then those younger people will deny to report other issues that is disturbing them. So we are also seeing that, and we are seeing how we can handle it with the police and the health facilities. Also, the help of the budget advocacy with the district, they have really tracked and monitored those activities that in line with the budget and in different sectors. And we are seeing how can we influence those activities, to see that they are done accordingly, to see that they are helping our young girls, and to see that they are getting enough help within those activities, or those units within the health facilities, or within the schools, with any other institution, to see that these activities of the district, that they are really done on ground, and they are helping our young girls to stay in school and to stay in a safe environment. Yeah, and we have been carrying policy meetings at the district level. These review meetings, they help us to give us a progress of our activities, what we done before, and what and how things have been moving. So that if they give us that strategy, if they give us those what they are doing on the ground as when they were implemented, and see what others are becoming so complex, and we, the APs, we come in and we help them, we join effort to see that our children are well protected within those regions. Thank you very much.
Yeah, yes. Thanks that you shared and brought in that aspect here.
Thank you so much. I have a question, please.
Yes.
Yes, I wanted to ask, how will the outcome of our discussion we had today help us or help Ugandans in advancing efforts to end child marriage in Uganda?
Hello?
Asking
Hello?
question to the co-presenters.
Hello?
Yeah, we can hear
Please
you.
go
Hello?
ahead. Yes, we hear you.
Can you hear me? Possibly you have what to contribute before that question is answered. Hello?
Yeah,
Yes,
please go ahead.
Yes, this is Reverend Stephen Kadiebara from the Fora. And for us, we engage the local councils such that they can also engage the families, because ending child marriage begins at family level. And sometimes the parents themselves have been compromising. So we had to engage the local councils to react to the families. And then secondly, at the sub-counties, to make bylaws, because different sub-counties have different norms, have different mindsets. So we had to engage the sub-counties to put in place relevant bylaws. And then at the district, these make ordinances, and also it's their work to oversee and regulate the local level councils. So it's what we have done, engaging the district councillors, see that the ordinances are made relevant in different communities. so that they strive hard to end child marriage. That's my brief submission.
Thank you. Namaru, your question is to the co-presenters or to us as a host?
My question is to all of us, especially maybe the host. How will the outcome of these discussions we have just had, or more other discussions we had, help us in advancing the efforts to end child marriage in Uganda? As we shared our challenges and the recommendations, after this discussion, how will it help or increase efforts in ending child marriage?
Yeah, thank you. So as a group facilitator, I'm sure you may have received earlier as well, that this presentation is part of a larger initiative where we are really trying to understand that across the globe, what has happened to the adolescent girls, and particularly in terms of their marital situations, whether it's child early forced marriage, and so that we can do a larger global sharing and call for attention for the adolescent girls issues, particularly in the area of child early and forced marriage. So that's where we as the global group represent, because from the next step from here would be to share this video at the global platforms, to really, so that a larger audience can know that who is doing what are the kind of solutions that are being tried across the globe, what is working, what's not working, how the government is responding, so that there can be a larger global call. So that's my response as a host. But what I expect all of you as a presenter is that maybe, like, you are attached to a forum of Girls Not Bride, which is brilliant. So I think that that's a major force or energy that you have, that as an alliance, all of you can go together to the government to create a pressure, be a pressure group for policy level changes. And similarly, I really appreciate one of the slides also mentioned the inclusion of young people themselves in the entire struggle, in the entire requirement for normative shift, which is going to create another kind of social pressure for shifting the norms and behaviors and practice on ground. This is my understanding at a distance when I hear all these conversations. Bahi, any more thoughts from your side?
Thank you very much. You have answered my question.
This is a wonderful question. And we also would like to invite you to join this group, which is a group that brings together actually people who are working on the ground in many countries, also people who are policymakers, those who are doing research, people actually from different sectors working together. So if you would like, you're most welcome to join this group also, and we'd like to formally invite you to this, because it's an ongoing conversation where we're learning together, as was mentioned, and as you all are already doing, I think, really learning by doing on the ground. And so this creates this space, it creates this opportunity to have an ongoing conversation about exactly the questions that you raised. So you're most welcome to join this international community as well. And you have already brought a lot, and you would continue to contribute a great deal. So I can follow up by email with all of you. And we thank you again for joining us. I think the time allocated to this has come to a close for now, and we can continue the conversation over time. And we would be delighted again to welcome you to this group. And thank you very, very much again for all your insights, for sharing your experiences with us. And I'm sure a great deal has been learned today. So thank you again to all the colleagues who joined and presented.
Thank you. Thanks a lot to the team Uganda. Thank you. Bye-bye. Have a safe evening. Bye-bye.
Thank you also for
Bye-bye.
organizing and giving us opportunity to share our experiences. We thank you and would love to join the group. And we are so much glad for everything. Thank you so much.
Thank you.
Thank you too.
Thank you too. Bye-bye.
Bye-bye.